Hi everyone, my name's Bailey. I'm a therapist getting my doctorate in counseling psychology, and I'm here to give you the insider scoop on the therapy process. Welcome to my new series, Therapy Explained. Today I'll be explaining the intake session. The intake session is one of the weirdest parts of therapy, and it can be really misunderstood. Before you ever start talking, there are a couple things that we have to clarify. So, the first one of those is confidentiality. Here's my little spiel. Everything you say in here is confidential with a couple limits. Those limits would be if I think you're a danger to yourself or someone else, I would need to make a report. If I find out about abuse of a protected class of individuals, like children or elderly individuals, I would need to make a report. And if the court subpoenas our documents, we would need to cooperate with that system. So that's the spiel I give at the beginning of all of my intake sessions. I'm going to be going over risk and reporting and hospitalization in a different video on this series. So, after I explain to my client what the limits of confidentiality are, I will probably do some explaining of administrative things like how long therapy sessions are, scheduling practices, cancellation policies, that kind of boring stuff. I usually then ask my clients if they have any questions for me before we get started, explain that the intake session is not going to feel like a normal therapy session, and also share that I'll be bouncing around between a lot of different topics and it's going to feel weird, and that's just the way it is for an intake session. After all of the administrative stuff is taken care of, we go into more of an interview. So I'll ask about your presenting concern, which is pretty much like the thing you're coming into therapy for or the thing you want to work on, the reason you're in therapy. That's what I mean when I say presenting concern. What brings you to therapy? That's usually where I start. And then we'll get into history. Usually, when we ask about history, we want to know what your childhood looked like, what your relationships are with your family members, if you have noticed certain things going on relating to mental health in your past. All of those kinds of things are really useful for us to be able to help understand what the landscape of your presenting concern is, where you're coming from, and what might be informing the current presentation. We're essentially jumping around between a bunch of different topics so we can get a broad overview of what things are looking like for you and figure out the places we might need to dive in when the actual therapy process starts. I might also be trying to figure out what kind of diagnostic impression I'm getting from the person. So if someone's coming to me and they're telling me that they feel really anxious around other people, always feel like they're being judged, avoid social situations because they're afraid they're going to make a fool of themselves, and they also have had panic attacks and do a lot to make sure they don't have panic attacks in the future. In my mind, I'm already starting to think, okay, we're looking at maybe social anxiety disorder and we're looking at maybe a panic disorder. To be fair, I made the symptoms very clear and consistent with the diagnostic manual, at least for where I'm living. The way that we diagnose things is through the DSM, which is the Diagnostic and Statistical Manual. We're on the 5TR, which is basically how many rounds we've been through of revisions. That's how we determine whether or not someone fits the clinical symptoms required for a certain diagnosis. If someone's talking to me and they're sharing certain symptoms, I'm usually thinking in my head what kind of diagnosis this might fit, or if it fits a diagnosis at all, because sometimes people come in and there's nothing really diagnosable, but that doesn't mean they don't need therapy. If you're wondering whether you might need therapy, please check out this video where I explain some of the things that might make therapy useful for you. To be really clear, everything in the intake session is preliminary. You might come in, tell me a whole big story about your life, and then we start therapy and you tell me that that was all a lie and you have totally different problems in history. Okay, fine. We'll just move forward from there. Not everything you say is set in stone, it's just a starting point. So, after collecting the history and understanding the presenting concern and assessing for risk, which I'm going to talk about in a different video, I really want to know what kind of goals you have for therapy. So, I might have my own internal goals that might not match yours, but I want to know the kinds of things you're hoping to get out of therapy. If you come in and explain a problem that's happening in your life, but the first goal you have is making sure you can sit through your classes without anxiety ruining your ability to focus, I know where we need to start, which is coping skills to manage anxiety. We'll get to other things in the future, but goals help me orient to what feels most pressing for you and what kind of outcomes you want to see. Something that's also really important during the intake session is building rapport with the client. When I say building rapport, what I mean is building a relationship with the person. If I say, for example, I have really good rapport with this person, it usually means that we have a strong relationship. And I might be able to push them and confront them in a way that would not work with someone who I have weak rapport with, or someone who doesn't seem to know me that well or feel that comfortable around me. Intake sessions are a great time to build rapport. I want to make sure you feel heard by me, that you feel understood by me, and set that foundation going forward with the therapy process. A lot of times, clients will be wondering in the intake session what the therapist thinks of you. They'll be thinking, does the therapist think I'm weird? Do they think I'm a bad person? Is this embarrassing? Do I sound crazy? Do I sound like I don't have any problems? All of these nerves around what the therapist is thinking. And I am going to tell you very, very, very honestly what I'm thinking when people are telling me about their history, their presenting concerns, and things like that. I'm not trying to judge whether you're good or bad. I am not there to make moral judgments. I'm not there to tell you if you're drinking too much or if you're smoking too much or I can't believe you did this thing or why did you break up with this person. I don't care about any of that. My basic assumption is that the things that you do and the choices that you've made in your life make sense. If you regret things, if you think certain things that you did were bad, whatever, that's your own biz. But in my mind, everything that my clients do somehow makes sense to them at a certain point in their history, given what they've gone through. I'm not deciding whether or not you're a good or bad person. I'm not judging you for the decisions that you make. What I'm looking for is patterns. I want to see if there are pieces of your landscape that connect in certain ways. So, for example, if you tell me that you had a very unstable relationship with your parents growing up and your presenting concern is relationship issues, that kind of indicates to me we should probably start work with attachment and thinking about how relationships look to you. My job isn't to figure out if you made the right choices in your life. My job is to figure out what has happened in your life so far and figure out how to help you move forward. If you're about to go into your first intake session, here's a quick reminder. You don't need to tell your story perfectly. You don't need to know what you need from therapy. You don't need to know how therapy is supposed to help you. You just need to show up and be willing to share, be willing to be vulnerable, and think about things you might want to change. You don't need to know everything right off the bat. We are here to help you do that work. Maybe it'll take time for you to trust the person enough to actually answer all of their questions. That's okay. Just showing up is enough. Sometimes coming in and doing an intake session will feel really pointless. You'll go in, feel like nothing changed and nothing's different, and you didn't get any help. And that's because we weren't doing therapy yet. So please just give it some time. Don't quit therapy after the intake session. Give it a second chance because you haven't yet done the therapy process. In the next video, I'm going to be diving into the things that make people really nervous about coming into therapy, which usually involves risk and safety questions. Thank you so much for watching my video. I really appreciate it. If you're interested in more content like this, or if you're interested in checking out some self-help book reviews, please consider subscribing to my channel. It really means a lot, and I'm still very new, so every interaction that you have with me helps me know that people are actually watching this kind of thing. I hope you have a wonderful rest of your day, and I'll see you in my next video. Bye!